A lot of people have low back pain, and in a previous video that I've done, I showed you exercises that you could do predominantly with your body weight. Now I'm going to show you exercises that you would do on pieces of equipment in the gym. Okay? The first one I'm going to show you is the Roman chair. This is for the whole back side of your body. Specifically, what I like about it is the glutes. So you just climb up on the chair, stick your feet in. You should be in a position where your ASIS, these little buttons, are off the pad. Okay? And then I like to just hold my body straight, draw your belly button in a little bit, hold your body straight, and then just fire your glutes and your hamstrings here. Don't externally rotate at the feet. Keep your feet facing the ground, and just fire the glutes. Now if you want to work your mid-trap, your lats, and your rear deltoid, just like you're on a cross, you're parallel to the ground, and you hold that. And for men, I'd like to see 2 minutes. For women, they could go up to 4 minutes. And the reason why I like this machine, as opposed to going up and down, which you normally see people do on a 45-degree like this, which is fine. It's easier. You know, if you're parallel to the ground, gravity's pulling straight up and down. It's a lot harder. You need 45 degrees to the ground. So I like this Roman chair because, as opposed to your posterior musculature turning on and off as you go up and down, you're just holding it straight out, which means you're getting neural input into those muscles. And if you remember, the gluteus maximus and medius are phasic muscles that have a tendency to become inhibited or weak. And again, this is not for hypertrophy. This is just to get the muscles to fire. So the more neural input into the musculature, the better it is. Okay, if you're going to use the 45-degree hip extension, then I like to do it one leg at a time. Because if you remember, if you look in your anatomy book, you'll see your multifidi are intersegmental stabilizers, but they can also rotate you to either side. So by doing it one-legged, since it's 45 degrees as opposed to Roman chair, it's a little less intense, so you can do it one-legged. And by doing it one-legged, there's some rotation, right? Because both legs aren't working at the same time. So you're trying to be rotated. So that your multifidi on one side have to stabilize even more and prevent the rotation. Okay, so again, your ASIS off the pad, keep the foot straight, and then here you can hold it or do repetitions, just holding it. Because what happens is my body wants to rotate this way because I don't have a leg supporting it. So I have to rotate the other way. Okay, this is real good for the lower back and the multifidi. Especially if you've been sitting in a chair, in a car, or just been sedentary for a long period. Okay, I'm sitting here, I'm going to do sit-ups. A lot of people do crunches instead of sit-ups to take the hip flexor involvement out of that. But actually, the hip flexor is attached to the pelvis, and the pelvis attaches to the lower spine. So I like to do hip flexors. Even though a lot of sedentary people who sit all the time might have shortened hip flexors, the hip flexors are weak. So I like to do them in this manner, okay? Put your tongue in the roof of your mouth to stabilize your head, like this. Go back down, but instead of keeping yourself in spinal flexion like this, go into some extension. Don't let your abs shut off. Keep some flexion, okay? Tongue in the roof of the mouth. Raise up. Okay? Sit-ups is a good exercise. Don't discount it. Don't discard it. Okay. Again, for the hip flexors and the lower abdominals, this is called a VKR, a vertical knee raise. You can do this a couple ways. Well, let me show you a couple ways people kind of cheat or make it easier. Instead of curling their pelvis, they just lift their legs up. This. That's a hip flexor exercise, predominantly. Another thing they do is they can't stabilize their shoulders, so their shoulder sinks. They should be able to hold themselves. Okay? So you can lift your knees or your legs, but you want to be able to curl your pelvis because your abdominals attached to your pelvis. If you're just lifting your legs, then you should predominantly getting mostly hip flexors. This is a hip flexor exercise, really. Your lower abdominals are stabilizing your torso. But if you curl the pelvis, you'll get your lower abdominals as well. Remember, weak abdominals, weak hip flexors can cause lower back pain. Weak hamstrings can also cause lower back pain. I personally like doing hamstrings one leg at a time, because if you're doing both legs at a time, you don't know, especially on a prone leg curl or a seated leg curl where you're pulling a lever with both legs, you could be using one leg more than the other. So belly in, or drawn slightly, chest up. Don't try and arch your back. Keep your pelvis in neutral, so tighten your abs slightly and work your hamstring. Okay? Okay, I really like this machine for lower back pain because you can work the hip in 4 different ways. We're going to do it as for your glutes and your hamstring. This little axis here, the center of this rotating pulley here, needs to go into the center of your hip. I put a slight bend in this knee, keep my chest up. Okay, now you perform hip extension and hold. You can do a bent leg and you'll emphasize your glutes more. I like to do it fairly, not straight leg, but slight bend in the knee to get my hamstrings and hold and squeeze there. What's really nice about it, you get glutes here, you get gluteus medius and your stabilizers on this side, plus you get a little abs because as I'm pushing on this, it's pushing me down. It's pushing me back. So my abs have to tighten. Because this is pushing me like this. So I have to tighten my abs as well. It's a great exercise. For the hip flexors, put this down at 6 o'clock. Put your hip in this axis again. And now flex your hip. Same thing. Don't crunch. Keep your chest up. Flex your hip. Okay, on this machine, you can go a little bit heavier as you get stronger. Right? What I also like about it is because remember I was talking about the rotation component, the multifidi? Well, as this pushes you down, it wants to